as a good host should, I take the opportunity to thank each and every one of you for taking your time out and joining us this afternoon. Ladies and gentlemen, this afternoon, we are discussing upon a very, very important subject, which is the health horizon. And in the recent times, we have witnessed and seen that Assam's health sector is undergoing a remarkable transformation driven by its policy reforms with infrastructure development and, of course, the advancement in the technologies. And having said that, ladies and gentlemen, now that we have distinguished dignitaries with us on stage, may I kindly request Dr. P. Ashok Babu, sir, to kindly felicitate our Minister, sir, Shri Ashok Singhal, sir, Honorable Minister for the Department of Health and Family Welfare and Irrigation, Government of Assam. Thank you very much, sir. May I now request Shri Siddharth Singh, sir, to kindly felicitate Dr. Sanjeev Narayan, sir. Siddharth, sir, I would also like to request you to please felicitate Shri Tanmay Saxena, sir. Well, thank you very much, sir. And ladies and gentlemen, now the welcome address on Assam 2.0 here at the breakout session is due. And to do exactly that, may I please request Shri Siddharth Singh, sir, Commissioner and Secretary to the Government of Assam, and to do the honor by rendering the welcome address.
Honorable Minister, Health and Family Welfare, Shri Ashok Singhal, sir. My colleague, Dr. Ashok Babu, esteemed in this hall, and because of the space constraints, we've not been able to accommodate all those who wanted to participate in the session. A very good afternoon to all of you. I welcome you on behalf of the government. Exchange. This is and you all are aware that the government of Assam, under the leadership of the Honorable Chief Minister and the Honorable Health Minister, is taking a lot of interest on the health side. Now, the tertiary sectors, a lot of work is done in Assam. You all are aware that till 2009, we only had 3 medical colleges in Assam, and last year, in Assam in 1 year. Thank you. So we have 14 medical colleges coming up. We have the largest cancer care chain in the country. We have 9 cancer care hospitals, Tata Trusts, that we are running, and another 8 are coming up. That would be the biggest cancer care grid in the country. We have started a company with IIT Guwahati, where we will have the doctors and engineers working together, and that is going to be a major research hub. So apart from that, on the primary and secondary healthcare, a lot of work is being done by the government of Assam. So we seek the participation and cooperation of all the stakeholders in this endeavor, because the journey is very long. We don't want people from our side to go to Chennai, Bangalore. They can go there for their leisure, they can go there for definitely not treatment, and that is the partner to ensure that the best treatment is available. We are trying to be the medical tourism hub of the northeast of the eastern sector and parts of Southeast Asia, as well as South Asia. we are marching towards that goal. And not time. Once again, on behalf of I'd like to thank you all for taking this time and coming. And we seek active participation of all of you in this session. Thank you so much.
Ladies and gentlemen, as stated, the key objective or the key focus at the moment is to, of course, provide proper and quality healthcare facility, along with that making it accessible and affordable. However, ladies and gentlemen, it is now time for us for the inaugural address, and to do that, may I please request Shri Ashok Singhal sir, the Honorable Minister, Department of Health and Irrigation, Government of Assam, to kindly address the gathering.
Health Horizons, transformation in health sector. This particular session is dedicated to health sector in state of Assam under Advantage Assam 2.0. Commissioner Secretary MERD, Babu Commissioner Secretary, Dr. Sanjeev Narayan, Chairman, SOCHM, Northeast Development Council, Tanmay Saxena, Chief Operating Officer, Tata One Energy, Azhar Khan, Senior Vice President, Sun Pharma, CEO of Technologies. We have as panelist Professor Ananda Sarma, and All India Institute of Ayurveda, Dr. Anurag Vasne, President, Drug Discovery at Patanjali, distinguished guests, doctors, and stakeholders in the health sector. I welcome you all to this session of Advantage Assam. It is a great pleasure also to see all of you on one platform where we would discuss the opportunities in Assam, changing scenarios of health sector in Assam, where we can partner with each other, how best things can come to Assam with your partnership. We will be happy to know that health sector transformation in Assam is very rapid, very fast. The Honorable Chief Minister for a long time was heading the Health and Family Welfare Department, and you will be happy to know that Assam has 14 medical colleges running. One Ayurvedic college is there. We have other Ayurvedic facilities in pipeline. And likewise, sub-centers are there. Around about 5,000 sub-centers are there. More than 1,000 public health centers are there. Community health centers are there. Now, we are looking for partnership with you all. We want you all to come participate in this progress, participate in this transformation. A lot of companies, a lot of hospitals, some big names also has come forward. They have signed MOUs or are in process of signing MOUs for putting up, setting up hospitals here. That way, it is a welcome sign. There was a time when patients from Assam used to travel to Chennai, they used to travel to Delhi, they used to travel to Bombay, they used to travel to Hyderabad. Under the visionary leadership and taking opportunity of this Advantage Assam 2, we have invited big names from the health sector to come participate so that our patient, particularly patient from Northeast, more so from Assam, don't have to take trouble of traveling all the way to other states for healthcare and treatment. So I think that the lot of MOUs are getting signed, to name few. Vedanta already has signed, Lilavati has signed, a lot of other big hospitals they have signed, and roundabout total number of MOUs signed on health sector is 11 MOUs has been signed. Life Care Hospital Limited, Foundation, Global University, EdLife, SBM Super Hospitality. Then we have Global Health Limited, that is Medanta. Some hospital from Visakhapatnam also want to put up 500 crore. So this is how the investment is started coming in. Next 3 to 5 years, the private health infrastructure in this state will take a lot of transformation. And these are changing times. These are the time, these are the opportunity which every entrepreneur, every businessman, they look for. Assam is ready. That is now where in Assam, what to do. It is not about only the patient care. It is not about only medical. We have a lot of other opportunities also. After Kerala, Assam can be hub of alternative medicine, alternative healthcare, that is Ayurveda. Topography, weather, nature, if you see, we resemble to Kerala to a great extent. So, people should explore that also. Holistically speaking and looking. Awareness now about health, healthcare. It is not about surgery, it is not about medicine. People want to be healthy. The desire to be healthy, desire to be fit in the society is growing. The reason being the affordability has increased. Economic standards has gone up. Economic activities are taking place. So in a growing economy, desire to have good health, desire to have good things, all good things are available in the world. The first choice will be good health. Then only good house, good car, good this, good see, good friends, good club, good film. But the first is good health. So I think you should look at that also. Growing Indian population is aspirational, which can afford and which want to be at a point of time. What service we can provide them. It's not about only hospitals or medical facilities. There are other things also to look at, which I feel all India also that is not that high. Presence is not that very high, but in times to come, this is going to be a very big business. So you can look at the opportunity also. I have already said that we have good topography, grid is good, weather is good, available, and atmosphere also is conducive for this kind of activity. So Ayurveda, preventive health, wellness, that can be one part of your plan. You can partner us, you can partner with others also in this sector also. And I feel with the development of technology, when technology coming in place, how in health and family welfare, we can use technology to the maximum. Because India is a country where the presence of internet, data, smartphone per capita is very high. Our reach in the rural population also is very good. Data is the cheapest in the world. DBT, maximum number of DBT is what we are doing. That is the highest in the world. UPI transaction, highest in the world. Tata 1mg is sitting, he will explain, CEO is sitting here. So these are transformation that is taking place. Tata 1mg probably in a very specific time, anywhere in the country, if I'm not wrong. So this is a technology. See, this technology must change. It must, the disruption must come in the set pattern of things what we have been doing. That. So where you can technology and bring sophistication, bring in providing better services, that we need to think of. This session is all about that. Even though Honorable Chief Minister has given me the Department of Health and Family Welfare to see that the Assam is fit and fine. I'm not a medical practitioner, I'm not a doctor myself, but as all about medical and treatment, it is about well-being, wellness, fitness of the large population of this state, and we want to go ahead in that line. It's not post-accident, but it is about that there should not be accident. We need to reduce non-communicable disease. We need to reduce the stress level. We need to create a where health is kept. Medical science does not have treatment for the mental health. And people are in stress. As the economy is growing, the stress level is increasing. People are competing with each other. The students, that day in the assembly, there was a question why a student of class 10 has committed suicide. So this is a new phenomena with growing economy, growing standards. These problems are coming in. Earlier, the problem was with the Western world only, when we were underdeveloped. Now the status of economy is changing, status of country is changing. The problem is coming when prosperity comes, it does not come with all good things. It comes with the bad things also. So we need to make good, fine balance between things. And I believe this session is all about that. We need to look at 360-degree horizon of health, not only the medical care, but the health care. I believe all of you will participate and make this session healthy and a fruitful session. I again welcome you all to the session. Thank you very much.
Well, thank you very, very much, sir. Well, ladies and gentlemen, the state of Assam is making significant strides in terms of public health is concerned, well, in terms of medical education is concerned, and also Ayurveda. Well, it is now time for us to proceed ahead with the panel discussion. We would be discussing on a very important subject, which is Health Horizon, and we have broken this into 3 sessions. To begin, we will have the first session on patient care, new opportunities for Assam. The second one, which is biomedical device, new avenues for manufacturing and investment. And finally, we will have wellness, focus, Ayurveda, yoga, and diet. And this session, the first session, which is patient care, new opportunities for Assam, the session will be moderated by Dr. P. Ashok Babu, sir, IS, Commissioner and Secretary to the Government of Assam Health and Family Welfare. And we already have a panelist with us, Dr. Sanjeev Ray. He is a national award-winning entrepreneur producer who has significantly impacted the regional TV and news and media. But ladies and gentlemen, he is somebody who is a top-notch businessman in Assam, leading SN group of companies encompassing 29 diverse ventures across multiple sectors. We also have in the midst of us Sir Tanmay Saxena. Tanmay is the Chief Operating Officer of Tata 1mg, India's largest digital health platform. With his strong leadership skills and strategic approach, Tata 1mg has seamlessly operated as India's largest online pharmacy, diagnostic and consultation platform. Well, ladies and gentlemen, with this, it's time for talks on patient care, new opportunities for Assam.
And my colleague Siddharth, distinguished panelists, and all the dignitaries. Let me, as a moderator, just let me a small introduction and some ground rules, which everybody of us better to stick. first and foremost is when the Advantage Assam 2.0 was thought about, around 7-8 sessions were planned, what we call breakaway sessions. Chief Minister has suggested we must discuss the health and what is ahead in the health and where we are, what we call health horizons. And when we sat together with Ashok Singhal sir, it is about patient care, it is about wellness, it is about the new technologies that are coming. Let us divide, let us identify the best persons here and let them talk to the delegates and let them tell what is happening, what are the horizons ahead for us, and where is Assam, and what are the opportunities, etc. Then we have listed panelists here, and Mr. He has an enormous experience in the health infra. Tata 1mg, as we already heard, it has made a new path-breaking solution to certain things called drug delivery. And coming to the patient care and new opportunities, the doctors whom we saw are no more patients, whom we saw are no more patients. Previously, people used to go to an MBBS doctor, now one specialist, super specialist, multi-specialist, and expectations are growing. Coming to the patients, they are just not your consumers. Whatever doctor, they're not going to take it simply like that. They will ask you questions, they will study Google and come, they will study Mayo Clinic material and come to you. So is a new way. Now the basic ground rules, we request each panelist to 5 minutes maximum. After that, we'll go to the next session and next session. Later, there will be question answer session from the panel for the delegates who can make panelists. Thank you. I request Dr. Sanjeev Narayan, your 5 minutes starts, please. We request you to start your.
Honorable Health Minister Ashok Singhal, ISP Ashok Babuji, Siddharth Singh and Tanvi sitting in the dais, distinguished guests sitting in front, ladies and gentlemen, and our friends who have come from outside our state to invest in our state. The first line that I would, want to say is giving you a warm welcome with all the support along with the government from the private sector for the investments that you all have planned to do here or are planning to do here. We can assure you, you all will find this as the best state to put in your money at. I am a firm believer that the government cannot do all. The government needs participation from the private sector. It is not possible for the government to take care of the entire population. Our population is huge, it's massive, it's humongous, and the participation of private parties is very important in each and every sector. And as Honorable Minister said, health is wealth. So the first sector that comes into mind is health. I had a late entry into the health sector, and the first point of entry was with the MK hospitals, which we built, and today it's one of the big brands of the Northeast, I can say that, with a lot of affirmation. We are coming up with 2 more hospitals. I can see the potential in the health sector. That was the reason why, we started investing into the health sector. We could see a lot of gaps are still there where we can come in, we can fill in, and we can give the services to the people of Assam. There are a lot of gaps in the cancer sector, a lot of gaps in the cardiac disease, in nephrology. So we know that a lot of things are possible which by the private sector can be done, but yes, if it is partnered with the government, it is nothing like it. So the future of all this development is PPP mode. I request the government understand very well why PPP mode has to, grow. If they want fast development, if they want things to happen very fast. There is a time limit for everybody. Even our life has got a time limit. And we want to do a lot of things in a short span of time. So for that, collaborations are most important. And we see as and when collaborations have happened, the countries, the states have progressed and progressed to a great extent. So health, we also are lacking in the transportation facilities for in the health sector. We see that half of the patients they die because they don't reach the hospital in time. It takes time for them to reach the hospital, and by the time they reach the hospital, they are no more. So the treatment to be given at the right time is more important than what you're giving. The patient needs to get the treatment at the right time if an accident occurs, or if an emergency occurs. And that is where, we feel we are lagging behind. The state government has already started 14 medical colleges. Another 10 or 12 are in the pipeline, and our Honorable Chief Minister always says that he wants to see a medical college in every district. So we have 33 districts. We know that there is a pipeline of 33 medical colleges coming up. But yes, that will take time. And that doesn't mean that the private sector doesn't have time to, develop or give these services to the people of this state. I can see a lot of distinguished doctors sitting over here. They have done yeoman service for people of Assam. They are still striving, working very hard. I would like to thank them from my heart for doing their work. Yes, as our Honorable Minister said, time we have to change. Change is something which is constant. New technologies have come up. We need to adapt to the new technologies. And before finishing off, I would like to tell one phrase of my grandmother. My grandmother used to always say that people get sick only 50% physically. Rest 50% they get sick mentally. So it is very important for the doctors. I always speak in my hospitals whenever I get a chance to speak to the doctors. I always request them, that they should interact with the patient or the attendant in a very soft manner or in a very cordial manner and try and explain them everything. Why? Because when they come to the hospital, the attendant is with him, and whatever the doctor says, tells to the attendant passes to the patient. So the mental health is as important as physical health is there, whatever treatment is being done. A lot of people are doing that. I'm not saying they're not doing it. Another experience that we had when I went to Hyderabad, I experienced, and from a very famous doctor, Dr. Nageshwar Reddy, he told me that, Sanjay, try to give the best of the facilities to the attendant. I asked him that why have you put a full-fledged attendant bed in the room? Because it takes a lot of space, and generally in Assam we tend to give small beds so that the attendant is always awake. It's not comfortable for him. He says, and he gave that. So his saying was, that the attendant is more tense than the patient because the patient is already lying on the bed and you need to take care of the attendant. So this was one pick that I got from him, and I'm trying to implement that in the hospitals that we are coming up with. We will try our level best to improve the infrastructure of medical in Assam. And I can assure you all, with the 2 hospitals that we are coming in, we are getting the latest technology, we are getting the latest machineries, and we'll ensure that people who suffer just because of transportation will not be there. We are setting up a hospital in Upper Assam, which was due for a long time. They didn't have all those facilities that are not there. In Guwahati, we know that we have a lot of things in Guwahati. One thing today, since I've got a chance, publicly I'll request the government also, whether it is in PPP mode or they do it themselves, they should, put emphasis on having the air ambulances in Assam, which is very important for the survival of a patient. When we go abroad, we see that every country are so vigilant about ambulances so that, the person gets treatment at the right time. So whether it is on the PPP mode or the private mode or the government mode, any mode is okay with us. But Those facilities, I believe, should be here. And I, being from Assam, am a firm believer that we in Assam should have the best of everything, and we should not lag behind anywhere in any department. Thank you so much for having me here. Thank you.
Honorable Minister Shri Ashok Singhal and distinguished panelists, it's a privilege and honor to be sitting in this panel and in the state of Assam. And this is also very close to us, and I'll talk about how it links to the mission of Tata 1mg. 10 years ago, when we were founded, we stated this as our mission, which was making healthcare understandable, affordable, and accessible. We have stayed true to this mission for the last 10 years. We can track our progress over 10 years. It's very important for us to make sure that we follow each word, because healthcare is such an important and a sensitive subject. And clearly, here I can see how everybody is deeply passionate about it. Make sure that we solve for healthcare problems or healthcare delivery problems for India, and not just borrow models in the West, because healthcare, there aren't great examples of delivery of healthcare if you look towards the West, right? So I think India will make its own path, and I'm a very true believer. And 3 years ago, I had the honor of meeting the Honorable Chief Minister. I could already see that there is visionary leadership in this state, and we have been attached right from the beginning with the ACCF project. Was right in the beginning sort of stages there, to today, almost 3 years of the privilege of serving, exactly the promise, which is access to healthcare and affordability. We are servicing almost 9 locations, 19 pharmacies. It's not an easy geography. Development is underway. The state is going to see a lot of progress, but till then, we are making use of making sure all medicines, whatever is needed, is accessible to the patient, to the doctors, and this is essentially the core to where we are. And again, this leadership is inspiring because it allows us to plan for how we are going to look at the state of Assam for the next 4 to 5 years. And this year, it is our focus area. We are going to invest more in infrastructure. We have plans of opening our own sort of labs here so that we can start providing healthcare at home, sample collection at home. We already have a state-of-the-art house in Guwahati. We are put in more pharmacies, and all linked through technology, so that whether you walk into a store or you're at the comfort of your home, medicines, tests, all that will be delivered to you, with the highest quality and highest standards, right? So that's our commitment to the state, and clearly it's very inspiring for us as a company, and we are very privileged and honored to be partnering with the government. I'll take that as a to the state and to the government, and I really, really am looking forward to a long and enduring partnership.
Now we'll move to our next session. I request the panelists, you can just sit down. We invite the new panelists, please.
Well, I extend my big thank you to Sanjeev and also Mr. Tan. Please take your seats. Well, now, ladies and gentlemen, we move on ahead with the next session, which is a session on medical devices, new avenues for manufacturing and investment. And we have with us Mr. Zadar Khan, Senior Vice President, Corporate Relations and CSR, Sun Pharma. Well, Mr. Khan is a key figure at Sun Pharma, the world's 4th largest specialty generic pharmaceutical company. His leadership in corporate relations and CSR initiatives has contributed to Sun Pharma's sustainable growth and impactful community programs. A hearty welcome, sir. We would also like to welcome on stage Mr. Arjun Arunachalam, CEO, Voxel Grids. Well, ladies and gentlemen, talking a little about Sir Arunachalam. Well, he's the founder of Voxel Grids, dedicated to developing cost-effective, high-quality MRI scanners in India. And I would like to request Shri Siddharth Singh, sir, to kindly felicitate both our speakers. Well, ladies and gentlemen, we begin by felicitating Shri Khan, sir. Request sir to kindly felicitate Shri Arjun Arunachalam, sir. Ladies and gentlemen, this session will also be moderated by Commissioner Secretary, Government of Assam, Health and Family Welfare.
First of all, let me thank the panelists who have made time and traveled and coming here. The technologies, the medical devices, when we look at it, it's mind-boggling. You could see the wearables, probably had last night's sleep or not, the artificial intelligence, and recently the 3D printing. It is going to replace the organ donation. They are going to print the organ you are going to be requiring. So when we look at in the medical devices, we have the two extremely knowledgeable panelists with us. Now I request them to give their session. I request them to finish in 5 minutes max, please. Thank you.
The Honorable Mr. Shri Salji, senior officers, thank the Government of Assam for inviting me here. This is my second participation in the Advantage Assam. I participated in Advantage Assam 1.0, and this is the second participation in 2.0. When we participated in the first Advantage Assam, our investment in Assam was only 300 crore. But I think over the year from 2018, today, I think the company has, our investment in Assam is now around 800 crore. And we employ about 1,350 people here. So that is the kind of environment we got in Assam, which encouraged us to invest more and more. And if you see today, in fact, we are operating almost 11 states in the country. But I can tell you confidently that our experience in Assam is very, very different. I think it's a very peaceful place, very cooperative people, and very business-friendly environment. Anything what we experience, ease of doing business, we are actually experiencing the ease of doing business here. And this is what I think encourages us. Other than this, we have additional plan of investment for which we are talking with the government for signing MOUs, etc. So I think this is a wonderful place and very business conducive environment we find here. The business what we do, I think we are in the pharmaceutical manufacturing. From Assam, we export to almost 7 countries, other than meeting the requirement of the country. But although we manufacture the pharmaceuticals, etc., I think the core thinking is that the patient has always been the center of our attention. Because whatever we do, we always keep the patient in the center of our planning. As Honorable health minister said, actually I am very impressed by his inaugural address because what he talked about health. Health is a very comprehensive issue. When we talk about health, health is physical health, mental health, social health, as well as spiritual health. So all these four components of health make a complete health. So he very nicely put it that health is not only a physical health, his health is a component. So when we talk about health and when we think about patient, I think our focus has always been how we can make the patient more comfortable and avoid those kind of a medication errors which lead to patient safety. The patient safety and avoidance of medication error is one of the important cause of our planning. I will give you just two examples. There is an anti-cancer drug called gemcitabine that used to be administered to the cancer patients, but it was a lyophilized powder, and we noticed that there have been dilution errors when nurses prepare dilute this. So, you know, all anti-cancer products have toxicity profile. If it is overdosed, then there is a toxicity issue. If it is underdosed, there is a efficacy issue. So, we continuously work, and it was a very difficult product to bring out because the lyophilized powder is stable and it is not stable in a liquid form. We continuously worked for about 4 years in our research, and we were able to develop a product which is a ready-to-use injection for gemcitabine. Ready-to-use bags which we use, for which we have got a patent, and this product is also exported across the Europe and US both. So this only the objective was only how to avoid medication error and have patient safety. Another product I think which we give completely free of cost to the patient is a product which is used for motor neuron diseases. It is completely free of cost to people, to patients, which is called Riluzole. The drug name is Riluzole. Our brand name is Riluter, which is just you give us a prescription of a doctor. The product by courier is supplied free of cost to the patient. The third process is that motor neuron disease patients are completely immobile. They are burden on the family, and people are not willing to spend money on their treatment. Therefore, we thought this could be the best service to the humanity by providing these products free of cost to the patient. So we are providing this, and these are the kind of things. So we are not only just for making money, it's a business, but at the same time, patient is our center of activity. We are adopting advanced technologies, etc. And once again, I thank the Assam government for this invitation and providing a very business conducive environment for us to be here, and encouraging us to invest more in Punjab because of the business environment friendly, the business friendly environment given in the Assam. Yeah, thank you very much, sir.
So first of all, thank you so much for the invitation here. I'll just share a perspective from a startup. I call ourselves a startup, although we've been around for 8 years. We build MRI scanners, and we are the only company in India to build